Will the ultrasound make a similar impact in central neuraxial block is now in front of us. Okay. I have traveled in this journey for the last 6-7 years. I thoroughly understood, and then it is going to make a big impact in central neuraxial intervention as well. So I'm going to present to you here in this 30 minutes what is the objective is. I'm going to talk about how this central neuraxis look at through the ultrasound, both the lumbar spine as well as the thoracic spine. And then I'm going to show you video with these informations how we are doing our blocks. So all these terminologies are going to be new to you. Okay, don't worry about it. The name itself will describe what it is. So you just listen or see that as a movie. You need not, we're going to look at the lumbar spine. There are 3 longitudinal views and 2 transverse views and 1 cross view. These are all the 3 different probe orientation through which we are going to look at the PPT. Okay. The same problem as yesterday. So I'm going to make a small presentation to make you understand how the images are being generated, and then we will discuss this. So now there are 6 views. I said 3 longitudinal, 2 transverse and 1 cross view. The 3 longitudinal views are these. We will call it as a PMS is nothing but paramedian sagittal. Paramedian, this is a midline, everybody knows that this is a paramedian. And the orientation is sagittal means it's a vertical. Transverse means transverse, so you can easily understand. So the probe position is paramedian sagittal. These 3 words describes where you are going to keep the probe in the body with respect to planes and what is its orientation. Paramedian sagittal. What this probe position looks at is the transverse process. So we are calling it as a paramedian sagittal transverse process. Can you be able to grasp? Okay. Similarly, the next process is from lateral to medial. If you slide the probe, you will arrive at the articular process. We will call it as a paramedian sagittal articular process view. And from there, if you make an oblique tilt, you will cut the interlaminar space like this. So that time we will call that view as a paramedian sagittal interlaminar view. So the paramedian sagittal is nothing but a probe position. Depending on what structure it looks at, we call the name. Paramedian sagittal transverse process, articular process. From there, if you make an oblique tilt, you will cut the lamina. Why we are making oblique tilt instead of sliding the probe is laminas are like this. So articular process somewhere there. From there, we are looking at the interlaminar space. If you slide, the ultrasound beam will hit the lamina and get reflected like this. You will not get a good image. So that is why we are making an oblique tilt to get the interlaminar view. So these are all the 3 views on the longitudinal axis. And then there are 2 views on the horizontal axis. So if you place the probe across the spinous process, it is known as a transverse spinous process view. If you slide the probe between the 2 spinous processes, we will call it as an interspinous process view. So can you be able to understand the terminologies and where the probe is positioned? And then finally, the paramedian cross view, which we are going to describe now as a new views, where it is going to be utilized for real-time interventions. It is nothing but you are going to place the probe on the paramedian sagittal articular process. From there, you are going to rotate the probe by about 20 to 30 degrees. We are not going to obliquely tilt, but we are going to rotate. So we are going to cut the central neuraxis in a cross sections where you are going to produce an image and look at the target. This is the interlaminar space which we will look at. So these are all the 6 views through which we are going to look at the lumbar spine. So now the next thing is I am going to explain when you put the probe in these places, how the image will get generated. So first position is paramedian sagittal transverse process view. Once you put the probe across, you will see the transverse process like this. And everybody know that the bone in the ultrasound is easy to identify because it produces a clear hyperechoic line on top and then the dense shadow below. You cannot see anything below. So by which we can identify the bones better than nerves. Everybody will agree. The blood vessels and bone easy to identify in ultrasound. Muscles and nerves are very difficult. So if you relate the nerves to any one of these structures, it is easy. So the transverse process is going to get visualized like this, a clear hyperechoic line with a dense shadow below. And similarly, if you slide the probe and arrive at the articular process, these intermittent hyperechoic line will become a continuous line and dense shadow below because one articular process is going to interact with the other. Okay. So in the transverse process view, there is an intermittent hyperechoic line, whereas once you arrive at the articular process, these intermittent hyperechoic line will become a continuous line. And from there, if you make an oblique tilt across the interlaminar space, this continuous line is again broke, and then you have an intermittent hyperechoic line, but the shape has completely changed. So you can see the lamina is never flat. There is a ramp is going up and then coming down. Between the two ramps, you can see the interlaminar window through which you are going to look at the spinal cord. So this is how the paramedian sagittal oblique view is going to cut the central neuraxis in this plane. So how the ultrasound image looks. So when you put a paramedian sagittal oblique view, you can see that these are all the tips of the transverse process, and you can see a dense shadow below. Can you able to appreciate how the image has been created? Since it looks like a trident, they called it as a trident sign. So I'm going to propose a many pattern recognition terminologies. In the spinal sonography, we are still in a pattern recognition zone. In the ultrasound, we have raised above it. We now identify the individual element itself. But still in spinal sonography, still all of us has to mature and understand, we are still on the phase of pattern recognition. So I am going to give a name for this. Since it looks like a trident, we are calling it as a trident sign. So from there, if you arrive at the articular process, these intermittent line is going to become a continuous line. So since it looks like a hump of a camel, it's an imagination of the first describer. So that it's ups and downs, but it's continuous. So they called it as a camel hump sign. So whenever you see a trident, you should know that I am at the tips of the transverse process. When these lines become continuous, you need to understand you arrived at the articular process. And from there, if you make an oblique tilt, see these continuous line has again become an intermittent line. And in between the two ramps, you can see the central neuraxis. This is where you will see the spinal cord. Since it looks like an head of an arse, they called it as an arse-head appearance. So these three signs or pattern recognition, you need to relate to these three views. So one is trident, that is a transverse process view, camel hump, that is an articular process view, and then arse-head appearance, that is an interlaminar view. Are you with me? Okay. So now coming to the two transverse views. If you place the probe across the spinous process, it cuts the central neuraxis like this. You can see this is the spinous process, and these are all the two lamina on either side. The ultrasound image is going to look like this. So this is a bone because you can see a clear hyperechoic line, and then the dense shadow below, you are not able to appreciate any structure below to it. Since it looks like a tower, they called it as a tower sign. So the transverse spinous process view, you will see a structure similar to a tower. The peak of the tower is the spinous process, and the two lateral ends indicates the lamina. If you slide the probe between the two spinous process, you can understand there is no tower in between. On the other hand, there are two articular processes on either side. This is a right articular process, that is a left. These are all the two transverse processes on the lateral side. So this is how the bony canal has been transacted by your ultrasound beam. The ultrasound image is going to be look like this. So there is no tower in between. On the other hand, you can see something vaguely underneath. So this is the spinal cord, and this is the right articular process, this is the left articular process, and these are all the two transverse processes. Okay, you can see a small slit here. This is a facet joint. So this is the spinal cord here. Since it looks like a head of a cat, they called it as a cat head appearance. So all the five views, there are five pattern recognition. These ears indicates two articular process, and then these moustaches may be representing the two transverse process, which are little lower down, so that whenever you see this sort of a pattern, you should know that you are between the two spinous processes. So five sides. One is trident, camel hump, horse head. These are all the longitudinal views. Tower sign, cat head appearance. Okay, fine. Because it's quite dry, it's difficult to make it very simple and easy to understand. So now the cross view. So once you arrive at the articular process view, you are going to rotate the probe like this. So when you rotate the probe, it is going to cut two different vertebrae, the spinous process of the cephalad vertebra and the lamina of the lower vertebra. Can you able to understand? So the ultrasound image is going to be look like this. So this is the lamina of L3 on the lower half of the image, and then the shadow of the spinous process of L2 on the upper end of the image. Between the two, you can see the interlaminar graph through which you can appreciate the posterior and the anterior complex. This is the your spinal cord. So this is a cross view. The point is here we are rotating, but we are not tilting the probe. It's only a rotation. Okay, this is known as a paramedian cross because you are on the paramedian. The essential position is paramedian, but you are crossing the midline. So we are called it as a paramedian cross. So these are all the views through which we are going to look at the lumbar spine. A quick video to demonstrate that. So you can see these are all the, what is this sign? Paramedian sagittal. These are all the three finger-like projections. So this is trident sign. So as you arrive at the articular process, these lines will become a continuous line. This is a camel hump. From there, if you make an oblique tilt, you can see a horse head. This is a transverse view where you are seeing the tower. And from there, if you slide in between the two spinous process, you can see the articular process on either side and transverse process. This is a cat head appearance. And then from there, if you make a rotation from the paramedian sagittal articular process view, if you rotate the probe, you will see lamina and then the shadow of the spinous process above. This is a paramedian cross view. So with these things, so these are all the 6 views that we will use to look at the central neuraxis. So by using them, how we will do our spinal is the next question. So one is, 2 methods are there. One is ultrasound assisted, another one is ultrasound guided. You use a probe to mark these landmarks on the skin and drop the probe and use these landmarks. You put your needle, that is known as ultrasound assisted. If you keep the probe throughout and introduce the needle in plane during the entire procedure, we will call it as ultrasound guided. So for the ultrasound assisted, from the below sacrum, we will count the spine up, and once we reach our desired space, we will turn our probe. You will see a tower. Probe down so that you will get a classical cat head appearance. That is an interspinous space which you wanted to put your spine. So once you arrive at that place, we will mark 2 lines. So one is the midpoint of this is the longitudinal axis of the probe. This is the short axis of the probe. Midpoint of the longitudinal axis, you make 1 line that is known as a spinous process. You know that the spinous process is on the center. That is known as a spinous process line. And then you mark 1 line on the short axis of the probe. Since the cat head is, what is it? Nothing but it is an articular process. So this horizontal line, we will call it as an horizontal articular process line. And you take out the probe and then connect these 2 lines. So that intersection point is where you will introduce your needle. So what angle that we need to take? Because the interspinous space and interlaminar space are not aligned against each other, they are misaligned. The interspinous space is little lower, interlaminar space is little higher. So that how the probe looks at, when you get a classical cat head appearance, the same probe angle, the skin probe angle you need to adapt. So this is how the probe looks at it, so you have to go in the same angle so that you can reach the interlaminar space. So this is how we will do our spine interventions. We will mark and then use the same angle. It's just a guesswork, or you can, through the app, you can take a photograph and measure the exact angle as well. So this is how we will introduce the needle to get our intrathecal axis. So this is one surface marking method. Like this, I have 10 surface marking method for scoliosis, obesity, elderly, many things. But that is too much of content now. So, but we will stop with this. I will scan this volunteer and show you how it looks like. Then we will go to the thoracic spine. Is that okay? So now I am going to scan the paramedian sagittal.